Now, this week is Women's Health Week during National Women's Health Month. It's the #1 cause of death for women is cardiovascular heart disease. Nearly 45% of women over the age of 20 are living with some form of cardiovascular disease.
And to tell us more about it, we are joined with Dr. Lana McGill, physician at Intermountain Health, and Michelle Martinez from the American Heart Association. And these numbers are staggering. We're seeing in the last 10 years alone that heart disease in women is increasing, especially young women. Dr. McGill, what is happening?
Well, lots of things. I think, 1 in 3 women will die of cardiovascular disease, which to most women is a shocking number.
That is shocking.
Yeah.
More than all of the cancers put together.
All cancers combined, yes. Your highest risk of death as a man or a woman is cardiovascular disease.
But it's a misnomer to think that it affects men more than it affects women.
Correct.
It's actually the opposite.
Correct, yes. And I think there's lots of reasons why women, discount their risk of cardiovascular disease, but there's a lot that we can do to prevent cardiovascular disease, such as monitoring your blood pressure, maintaining a healthy body weight. All these things can help prevent this disease, but again, we're not talking about it. We're not recognizing our risk.
Well, and it's important to know your numbers. It's really important, and also not to say that this doesn't happen in younger women. Michelle, I want to bring you in because at 36 years old, you suffered a heart attack.
I did, yeah, a week before my wedding reception. In fact, I had been skiing with some friends and my husband a half day and came home and I just didn't feel well. Had a lot of pain in my chest. It felt like someone was standing on me. I had a lot of nausea. And like most women, I told my husband, I don't feel well. I just want to lay down for a second. And thankfully, he's wonderful. And he literally threw me in the car and rushed me to the hospital. And they didn't know what was wrong because I'm not what I think you think of as a typical patient. I was 36. I was healthy. I was active. Hooked me up to all the EKGs. And the nurse came in and she said, honey, you're having a heart attack.
Would you have ever thought that? Would that have been your initial thought?
Never.
I just don't feel well. Heart attack?
No.
Those two don't correlate, do they?
I actually remember sitting there thinking, I'm going to die today, unexpectedly. I'm only 36 years old, and she just told me I'm going to die. And I had not thought about it at all.
And Dr. McGill, is this what you see often in your practice? Do often people present with sort of the same sort of complaints?
So it can be harder to diagnose a heart attack in a woman compared to a man because the symptoms can be different. So typically in men, you think they're very good at reporting this crushing substernal chest pain that's very, makes you immediately think that this could be a heart attack. Women, the symptoms may be that, or they may be nuanced. It might be, I feel nausea, I feel lightheaded, my chest hurts, my back hurts, my jaw hurts, I feel lightheaded. So it can be harder to diagnose a heart attack in a woman because the symptoms might be a little bit different, a little more easy to dismiss.
Well, and Michelle, you have no family history, which is a risk factor. But going back to knowing your numbers, your blood pressure, your blood sugar, all of those things, and Intermountain Health has these 8 Live Well centers. Let's talk about that.
Great, yeah. No, we really wanted to partner with AHA very intentionally to spread awareness for cardiovascular disease, specifically in women. And we do have these Live Well centers at Intermountain Health that can help you understand your risk for cardiovascular diseases, understand the risk factors, and then also take measures now to prevent the development or progression of cardiovascular diseases.
So go red for women. That is the color to bring more awareness, bring education, and make sure we're watching out for our women and, of course, men. #1 killer among men and women.
Yep. And Michelle, I'm so glad you're still here.
Yeah.
You're just a beautiful soul. And now she's on the board of the American Heart Association. I asked which came first, and obviously the heart attack. The board came second. Thanks for all your great work.
Thank you so much.